I would get usually an email with the CV and references from the aspiring doctor who wants to work in the company, and I read over the CV, because CVs are very varied. You get the classic one-page CV, which sometimes can be a little bit too skimpy. And we got a CV in the last 6 months that was 37 pages long, which was like reading a novel. So what we're looking for is something in the order of maybe 2 to 3 pages of a CV, and that generally gives you a good idea, good picture of the doctor that you're going to be interviewing.
Okay.
And you like to see on the CV the important things, like when they qualified as a doctor initially, and when they would have done any further degrees, like a degree in medicine like the MRCPI or the FRCS. If the CV looks good, then you have a look at the references. Okay. And the references generally tie up fairly well. And if you're happy with the references, then we set about setting up the interview.
Exactly.
Almost exclusively a Zoom.
Okay,
yeah.
Perfect. So it lasted at least 1 hour maybe?
The interview lasts generally, I suppose the average would be probably 40 minutes. Okay. I would say. If the doctor has all the ducks in a row ticked off on the CV, including a training in a recognised country as a general practitioner, that interview generally is fairly short, so that could be 25 minutes long. If the doctor hasn't got that sort of training, well then it's going to be a lot longer. Sometimes, generally once I get over 45 minutes in an interview, usually it's not going so well. Okay. And you're trying to tease out information, and maybe you're not succeeding with the doctor for all sorts of reasons. Sometimes it can be something as simple as a language barrier, and sometimes it can be, obviously, IT may not be working. There can be a drop in the Wi-Fi, and in a situation like that, it can be difficult because you're cutting the interview time and again, and it just takes forever. If the interview goes well and the references stack up, generally then we're happy enough to proceed with the doctor. Okay. And the doctor then is told by the recruiter, who they may deal with, that they passed the interview, the references are fine, and then they go about the process of whatever they need to do at that stage. Get Irish Medical Council registration. Some of them have it already. Some of them have a general registration because they've been mainly hospital doctors. Okay. And they then are in a position, some of them are in a position to go for specialist registration, which means that they would be in a better position in practice in Ireland to take on a GMS list. Okay. If they've got specialist registration. And I would encourage anybody who is on the general register, who is eligible for specialist registration, to go for it, because it gives them a better standing in the practice. They can become a partner quicker, and obviously they will be remunerated better, of course, in a situation like that. We encourage any doctor who comes in from abroad to attend the orientation day that we have in the office, and everybody gets offered that to come in, and most doctors take up that offer, to be honest. It's a good introduction to Irish general practice and the Irish healthcare system, and I myself tend to do the clinical aspect of it, and then Dr. Michael Joyce would do a Socrates training, which gives the potential GP an idea of what it's like to work the software system in the practice that they will be going into. What exactly does your working day look like? Because I need to know what they're going to be expecting, okay, and how many patients exactly will you see in the day, okay, and how much time do you get with the patient, all of these things, because I have to be able to say, look, when you come to Ireland, this is the job you're going to be doing. You're going to be seeing 25 to 30 patients, maybe 35 patients on a bad day. So we have to manage their expectations in advance before they even come to the country.
Okay.
Because some people like working in small practices.
Exactly.
I want to work in the country practice with 1 or 2 doctors. I don't want to work in the big practice in the city where there's 12 doctors. That's too much, you know. And people have choices there, and we do try and fit doctors in to suit their lifestyle and sometimes their family, because a lot of doctors do come with family also, and children, and they have to get the children into school. They have to live somewhere close to school, close to work. So there are, you know, it's a huge big jigsaw, really, that you're trying to put all the parts in together, that at the end it'll work.
Yes.
Why should you come to Ireland? Well, I think Ireland is a very pleasant country to live in general. I've been around, I've lived in a number of countries at this stage, and it's certainly up there in one of the better countries for lifestyle. I think the work-life balance in Ireland is fairly good. I must say I would have worked over the years as a GP. I would have also done other admin jobs as well, but I always felt there was plenty of time to do your own pursuits or your own hobbies. I don't feel it's like, say, somewhere like the United States, where you have to basically forget about your life and just you work for a corporate entity right through until you can't work anymore, and then you're passed over and the next bright young thing takes over from you. I don't think we have that ethos in Ireland. I'm pretty certain we don't, and I think that's important as well. I think it's a safe country. We don't have the same degree of sort of violence, or our children can go off and play in the parks and can generally go into town on the bus themselves when they get to a certain age, and you don't have to worry about them. Obviously things happen in every country in the world, but I think we have a much less sort of presence of that type of sort of concern for our children's safety. I think it's a nice place to rear children, myself, which is important, obviously. And I think that there's a nice commitment in Ireland to continue learning through your career as a doctor or whatever. I think there is that ethos, and the opportunity is there available to people if they want to continue doing studies. If, like, for example, a lot of the doctors that come over don't have maybe the experience in female health that they would like to have because of the culture of the country they've come from, but they will have the opportunity then to study or get practical experience in that when they come to Ireland, as an example, you know. And certainly Centric Health are very good in promoting ongoing education and practices.